Hello, the next 60 minutes are a presentation on detoxification in the naturopathic practice, and this presentation is made for the Alternative Medicine College of Canada. The aim of this presentation is to discuss in further detail the importance of detoxification in the naturopathic practice as a way of giving context to some of the teaching modules at the Alternative Medicine College of Canada. In the next hour, this is our agenda. We'll be discussing the importance of detoxification in the modern day world. We'll discuss what drainage means versus in-depth detoxification in the naturopathic practice, the hierarchy and order of detoxification physiologically in the body, and then we'll illustrate this theory with some clinical cases so that we can understand how to use these different tools in the real world clinical practice. So why do we need to detoxify? The body comes with its own built-in detoxification processes, which are mostly located in the liver, but also in many other organs. We have hundreds and thousands of different enzymes that are made for our body to detoxify itself continuously. This is important because just by the virtue of being alive, cellular processes create waste products that need to be removed from the body. These waste products can be acids, reactive oxygen species, and quite a variety of different types of toxins. Unfortunately, in the world today, we also have a lot of environmental toxins, which burden our detoxification processes further. Unfortunately, toxins aren't always able to exit the body adequately, and they eventually accumulate in various parts of the body, which leads to symptoms and the development of chronic illness. Ancient systems of medicine, just like traditional Chinese medicine or Ayurveda, had already recognized the association between toxins and illness, even 2,000 or 3,000 years ago. But the problem now has a new magnitude due to the level of environmental pollution which we're faced today and which is quite novel in our evolution. So when patients come to us with chronic illness and different types of symptoms, detoxification becomes a crucial intervention to enhance the patient's well-being, remove functional symptoms, and prevent or improve chronic illness. Detoxification has unfortunately become increasingly necessary due to the level of environmental pollution and stress to which we're subjected every day in the modern day world. So although the body is constantly eliminating toxins, our endogenous detox processes are sadly not enough to completely reduce toxins in our body, and this leads to what we call toxic burden or toxic accumulation in the body. Environmental pollutions is a huge contributing factor. Of course, poor nutrition, such as the exposure to food additives, food coloring, poor lifestyle choices, such as our stress levels, can also really reduce our ability to detoxify. And remember that our bacterial flora, if it is imbalanced, will also be a strong contributor to toxin exposure. The wrong bacteria in the gut can create a lot of LPS or lipopolysaccharide molecules, which needs to be detoxified in the body, or can lead to the development and triggering of lots of autoimmune illnesses. We are exposed to a number of synthetic chemicals that have roughly been around since World War II. At a time in which we did not know the full properties of these synthetic compounds, but now that these compounds are not very well broken down in our environment through our bodily mechanisms, but also through some of the planet's natural detox mechanisms, like through bacterial metabolization or fungal metabolization. And for this reason, a number of environmental pollutants persist in the environment. They are not broken down, and so they travel long distances through our marine currents, or are present in our air pollution and are carried from continent to continent by wind currents. They accumulate and contaminate our air and water supply. So recent studies where they have taken samples of breast milk, adipose tissue, or even sperm have all been found to be contaminated with a mixture, a cocktail of various different chemical compounds. They have literally been found everywhere in our body. And everywhere in our close environments. So for example, indoor air now is known to be very highly contaminated, and house dust seems to be a big reservoir for loads of different environmental synthetic toxins. One study located more than 45 of these different toxins in various North American homes. To illustrate where the body is getting its toxins from, and the reason why it's important to understand this is that a lot of the time our patients don't fully grasp the importance of detoxifying in the modern day world. They haven't really thought about ways through which toxins can enter the body. And we do have to spell it out for them so that they are motivated to make nutritional and lifestyle changes, reducing their exposure to various pollutants, but also to explain to them part of our treatment plan when it involves detoxification support. So, of course, through inhalation, we are all exposed to a lot of air pollution, both indoors and outdoors. So, outdoors, it'll be from car exhausts, for example, from haze, from cigarette smoking, and indoor, it'll be from volatile organic compounds that are being off-gassed by our mattresses, furniture. These VOCs are usually made up of lots of different types of flame retardants. But we also know that phthalates, which are important endocrine disruptors coming mostly from plastics that are found in our home, now accumulate in our dust and we inhale them. We are also exposed in general through our skin to a number of phthalates, parabens, perfumes through our skin, through our cosmetic products. So it's important to educate our patients about using environmentally friendly cosmetic products, because those that are friendly to the environment are also easier to break down through our physiological processes in the body. That also goes for makeup, foundation, aftershave, shampoo, any kind of moisturizer, and prescription items that may be topical. Of course, through our digestion or ingestion, we ingest, of course, some of our own house dust, but we also ingest pesticides, synthetic growth hormones, antibiotics, various food additives that are found in our food supply. Glyphosate, of course, is one of the pesticides or herbicide that has really come to the forefront lately due to its deleterious effect on our intestinal mucosal membrane and disruption in our bacterial flora. So again, it's really important to tell our patients to try and go for organic foods wherever possible, especially for their animal protein, to look for either organically raised animals or those that have been grass-fed without the use of antibiotic and hormones. Choosing organic produce is, of course, really important as well. And also the way they package and store their food at home, trying to stay away from plastic containers, plastic bottles, plastic wraps, aluminum wrap as much as possible in the kitchen. Our prescription drugs, alcohol, smoking, overindulging, which means overburdening our digestive and liver detox mechanisms in the body through our lifestyle and nutritional choices also occurs. When we're stressed out and we produce more cortisol and adrenaline, our liver has to work much harder to detoxify and metabolize these hormones so that it has less detoxification ability for the synthetic chemicals we're exposed to. And our bacterial flora, again, in the intestines is a repository for bacteria, viruses, yeasts, all of which will produce their own set of toxins that the body has to deal with. And of course, if a person has developed food sensitivities and intolerances, they will also burden our detox pathways. Finally, if we're exposed to in our environment to lots of molds, as it can be the case in many homes that are a little bit too humid or in humid climates, that can be a significant source of toxicity for individuals. So basically, our bodies have a great detoxifying ability. As you can see, it's even a miracle that we can still survive in the modern day world with the exposure that we had, but perhaps it's not a surprise that allergies are on the rise, in particular dust mites and dust allergies, when even our own household dust has become a toxic product, when our food supply has been so changed by our chemical and bioengineering. I didn't talk about GMOs in this little chart, but we could certainly add that. So our body's toxic load is significant. We have several new recent studies that have really confirmed that. So Body Burden, the Pollution in People, is the summary of a big study that was supported by the Environmental Working Group in the US. And you can take a closer look by checking it out on the internet. But basically here they tell you what they did. They looked at chemicals, pollutants, pesticides, 167 of them in the blood and urine of 9 adult Americans, basically people who had no chemical exposure either on the job or in their hobbies. And yet the subjects contain an average of 91 compounds, most of which did not exist 75 years ago. And at the bottom here, you can see the negative effects on health that these compounds can have. We have a lot of non-scientific literature that is gradually picking up on these topics. So this is from Scientific American, where they're talking about the air that we breathe when we're in bed at night. So about 8 to 12 hours. In 24 hours, we are sleeping on a mattress. And they basically show us on this little diagram that our mattress foam and fabrics often emit gaseous pollutants, including volatile organic compounds, plasticizers, and flame retardants. That this is particularly a problem for new crib mattresses for newborns. And that unfortunately our pillows are also a problem. The more we move around, the more we seem to be absorbing toxins from our mattress. And that is not really talking about the problem of dust mites and dust. So you see that having an environmentally friendly mattress, meaning one that is not made with toxic glues that will contain different types of VOCs, is important. So again, educating clients about using 100% organic latex mattress might be useful. Organic latex pillows, or using dust mite covers, airing their new mattress before using it, because it's often new mattresses that will emit more VOCs. This is one of the larger studies that was done a couple of years ago, and it was about chemicals in indoor dust. So you can see the details of the study here. But basically it shows that all sorts of different chemicals, phthalates, replacement flame retardants, fluoridated substances, synthetic fragrances, environmental phenols, and lots of other products were found in the average North American home. And you can see here what happens. These are colored bar graphs of the different compounds that they found in significant enough amounts for them to enter our body either through inhalation, ingestion, or skin contact, and that all of them combined can create all sorts of health problems, from reproductive problems. Remember that infertility and poor sperm quality is on the rise in every developed country, and in our children this is particularly a concern in the developmental impact that this may have on our children, and may contribute to the rise of autism that we currently observe. So the researchers were particularly concerned from our pediatric population, because young children, of course, spend more time putting their hands to their mouth, spending more time playing on the floor, and so on. Finally, WWF has sponsored a study in England where, again, they studied lots of different people, and found again that pretty much everybody is burdened by all sorts of different chemicals, from organochloride pesticides, PCBs, and other derivatives. And what was a concern, which you can see here in the first bullet point, is that every person tested is contaminated by a cocktail of known highly toxic chemicals which were banned from their use in the UK during the 70s, and which continue to pose unknown health risks. So even though PCBs, for example, have been banned since the 70s, they are so persistent in the environment that now, 40 to 50 years later, they are still found in our blood, in our adipose tissue, and so on and so forth. So toxicity is a real problem, to the point that in northern Canada, unfortunately, PCBs, DDT, and mercury has been found in very high amounts in the fatty tissue, blood, and breast milk of the Inuit population of northern Canada. And that has become such a concern that we are not sure that women in those areas should continue breastfeeding, as their levels of PCBs were 5 times higher than women in other parts of Canada. This seems to be because our persistent pollutants travel in the ocean and travel in the air, and due to marine and wind currents, they seem to be pushed to the northern hemisphere, to the tip of the northern hemisphere, and bioaccumulate in the marine population there. So seaweeds are loaded with these chemicals, smaller fishes eat the seaweed and plankton, bigger fish eat the smaller fish, and finally the Inuit population tend to eat the salmon and seals that are at the top of the food chain, where a lot of these fat-soluble chemicals have been bioaccumulating, which in turn become toxic for the Inuit population. So this is where we're at in the modern day world, and this is why it is important to educate our patients about this so that we can hopefully come up with solutions both for our planet, but for them to understand why detoxification is so crucial when we talk about health maintenance, including in the pediatric population. So we used to think that the placenta used to shield the fetus in utero from all sorts of toxins, but we're realizing that that is absolutely not the case. And in fact, newborn babies and babies in utero are one of the populations that is most at risk because of the bioaccumulation of these chemicals and the way it will impact their development and in particular their neurological development. So how do we measure the body's toxic load? A lot of the studies that have been carried out have, of course, tested for chemicals in blood, fat tissue, breast milk, urine. But in practice, we really only have two tests at this moment that allow us to assess that a little bit closer. The first one and the older one of the two tests is, of course, hair tests. Hair testing has been WHO approved for measuring heavy metals and in particular mercury. So it's a very cost-efficient test because it really only costs around $200 for your patient and just requires a small handful of hair that you can mail to specialized labs, and you will get a report like this one. For each heavy metal, you see a bar graph that compares the level of your patient's heavy metal contamination compared to the rest of the American population in percentile. So ideally, you want the bar graph to stay in the green. Most people have at least one or two levels that are in the orange, and very, very commonly do I see people with red levels. Hair tests are not as reliable for so-called healthy minerals like magnesium, chromium, iron, zinc. So I mostly use it for heavy metal assessment. And particularly in children, that's just very good because it's not that invasive, it's not painful, it's cost effective, and it can guide your treatment plan somewhat. The first step being, of course, if you pick up any of these heavy metals being problematic, is to reduce exposure wherever possible. So for things like mercury, we know it comes mostly from mercury in dental fillings and mercury in cold water fish like salmon, tuna, sashimi in general. So that's relatively easy to reduce. Arsenic, for instance, tends to be in our water and can be really hard to get rid of unless you're using reverse osmosis, which is a costly water filtration system. I have recently had patients that have increasingly high levels of barium and thallium, and I'm really unable to explain where it comes from. Thallium seems to be mostly a rodenticide against rodents, and most of my patients have no idea where they could have been exposed to it, but unfortunately, that's the state of affairs at this point. We do have urinary tests available, and that has been available to us only really recently. And these tests are unfortunately much more expensive than hair tests, but they do test for quite a breadth of pollutants, so not just heavy metals, but phthalates, fire retardants, derivatives of synthetic hormones, and so on, xylene, other plastic derivatives. So here I've just put a little piece of the report, which is literally about 5 times as long as this. But again, what they do is they give you a bar graph for each pollutant, and then they tell you where you locate yourself as a patient in terms of percentile for toxic burden from these environmental pollutants. So this test, I run it a lot less routinely than the hair test because there's a significant budget constraint. It costs around $700. But however, in some of my patients to have particularly strange symptoms, like for instance, I had a patient who was only in her 40s and she was experiencing significant muscle fatigue with any amount of activity, as well as a sensation of hot flushes that clearly didn't come from a hormonal imbalance associated with some changes on her blood work, like she had gradually reducing white blood cells and so on. We did run this test for her, and we found out that she was exposed to very high amounts of a certain type of glue that off-gases, and it is found in new mattresses. And since she had just moved here, she was indeed sleeping on a new mattress. And we got her to change her mattress. She chose a 100% coconut fiber mattress, and her symptom resolved in about 3 weeks after changing the mattress. So sometimes these more advanced tests can really, really help you locate the source of a particular agent of toxicity, and also allow you to target the treatment plan in terms of supporting the detox pathways in the body. and give an estimate of a prognosis depending on how contaminated the person is. So if you start running these tests on your patients, you will see that it's actually quite depressing to see the level to which we're literally full of toxins. So toxins will of course accumulate in the body. The body first tries to get rid of them through their organs, through its organs of elimination, which have traditionally in naturopathic medicine been called the emunctories, and we spoke extensively about those in another video. So first they will go to our emunctories and they will see if they can be eliminated from the body. But if they can't, because there are too many toxins for our detox pathways in the body, they will gradually start accumulating in other body parts. So they will start going first in our lymphatic fluid, which is a normal place for toxin accumulation, although normally lymph is moving and toxins are being eliminated from the lymph. But as the emunctories become backed up, so does the lymph. And when the lymph is backed up and full of toxins, the extracellular matrix, or ECM, becomes itself full of toxins. And that makes it much harder for the cell to evacuate its own toxins, and the cells themselves become intoxicated, so to speak. The body tries really hard not to let toxins sit around in our bloodstream or in sensitive body parts, so as much as possible it tries to store toxins in our fat or adipose tissue. There are some research papers out there that emit the hypothesis that a lot of us in developed countries may have problems with being overweight or obese, not just because our nutrition and our low level of physical activity, but also because the body produces more fat tissue as a way to protect itself from our toxin accumulation. That is also why breast milk is a significant source of toxins, because a lot of our breast milk is made from our fat tissue. Unfortunately, when level of toxicity becomes important enough, or certain types of toxicity will tend to have an affinity for particular organs. So for example, we know that aluminum preferentially bioaccumulates in the brain, and that's how aluminum plaques have been found in patients with Alzheimer's disease and dementia, for instance. Mercury likes to accumulate in the thyroid glands because it competes with zinc and selenium, which are particularly abundant in the thyroid. So different toxins can definitely target different body parts, although as you've seen with the cocktail of toxins that float around in our bodies, it can be a little bit unpredictable. The good news is that when we start to reduce our toxic exposure by changing our habits, our lifestyle, our nutrition, the body can very quickly start cleansing itself. And there is an order through which that detoxification will start occurring. So the body will first clear toxins that are circulating in the bloodstream through the emunctories, so liver, kidney, colon, and it will then start cleaning what is already sitting around in the emunctories. So, for example, when a person has a lot of toxin exposure, let's say through alcohol, or has a lot of fat tissue due to poor lifestyle habits, and there's fat accumulated in the liver will spend a few months cleaning itself out by putting out that fat and its toxins. And you will see that by a rise in triglycerides and blood cholesterol, which is quite normal. So in naturopathic medicine, when it's the emunctories that are cleaning themselves out, we call this the drainage. If the emunctories are blocked, meaning toxins have been sitting out there for a long time, or maybe the person has genetically a predispositions to emunctories that are not as effective. We now have genetic tests to see how our glutathione pathways are doing in the liver, for instance. Then drainage won't happen adequately. And so although the body is trying to mobilize toxins from their storage areas, they won't be able to get out of the body. And not only can that aggravate symptoms, but those toxins will simply deposit themselves elsewhere in the body, and it won't really resolve the problem or reduce overall toxic load. So before we move to in-depth detoxification, which is the cleansing of more stubborn toxins that may be sitting elsewhere than in the emunctories or bloodstream, for example, those that are stored in the fat tissue or in the brain or thyroid, this is harder to do for the body, and it can only be done if drainage has started occurring, or in other words, if the emunctories are functioning adequately. Remember too that weight loss allows stored toxins to be mobilized from the fat tissue to the bloodstream and will need to be eliminated. So any aggressive weight loss treatment plan, you should really make sure that emunctories in your patients are properly functioning, that they're having daily bowel movements, that bowel movements are smooth, that they don't have skin symptoms or a lot of mucus production, all of which indicate that the emunctories need a little bit more support. So when we start working with patients, we first need to work on drainage. So we first need to support the emunctories. And once the emunctories are being supported, and we can see that with what the patient is reporting in terms of bowel movements and so on, then we can move to the in-depth detoxification aspect of our plan. It's a little bit analogous to this picture here, which is, as you can see, a traffic jam in Thailand. So we have a traffic jam because there was probably an accident, and we have placed here these orange plastic barriers on the road. Because of this, you can see we have a number of motorbikes that are here at the forefront of this traffic jam, followed by a lot of cars, probably over a few kilometers. So draining basically first means reducing exposure to the toxin, which would mean clearing the site of the accident, right? And opening the emunctories means we remove these plastic orange barriers. We ensure that our pathway of elimination is opened. And so what will first happen in drainage is that the toxins that are immediately present in the bloodstream or in the emunctory next to the site of elimination, they are the ones that will move out of the body first. Once those motorbikes and maybe those two first big buses have moved forward, then all of the other cars will start moving again. And when these cars start moving at the very back of this traffic jam, a few kilometers away from where we are now at the site of the accident, in a way, this is what in-depth detoxification is. Obviously, depending on your patient's genetics, do they have good, strong emunctories? Of their nutrition and lifestyle, are they stressed out or not? Because if they're stressed, their emunctories are already not functioning optimally, and they have more toxins from their stress hormones that need to be detoxified. And the amount of toxins that have been stored and accumulated in their body from birth until now basically will determine how long it will take for the patient to get better, and give you a little bit of an idea of managing expectation for your client. The only exception to this rule of order or hierarchy of detoxification is perhaps when we use homeopathic drainage. So in homeopathy, we are able, of course, to take a substance, even a toxic substance, and to dilute it multiple times. So boron, for example, makes homeopathic lead, or plumum, homeopathic cadmium, which I've shown on this slide. And so there is some research now, particularly done on rats, which shows that when we feed a homeopathically diluted toxin to a person, it seems to help the physiology of the person to selectively work with a toxin and eliminate it more effectively. So with homeopathic drainage, you may be able to select toxins a little bit more, although I would still recommend to make sure that emunctories are open before starting this type of therapy. So as I mentioned earlier, we have spoken extensively about the emunctories in a previous presentation. So just as a way of a reminder, our main emunctories are the complex made up by the liver, gallbladder, and colon, the skin, liver, kidneys, and lungs. These are our primary emunctories, although recall that certain organs are not specifically designed for elimination but can serve to help with elimination if our primary emunctories are clogged. The menstrual period in women would be a classical example, where periods can start becoming heavy, problematic, or painful if the body is trying to detox through menstrual blood, in which case usually we need to support the liver, gallbladder, colon more extensively. So we spoke about how to support these emunctories in our past video, but I just wanted to touch a little bit more on how to support the colon, because it is really the first emunctory that we should be looking at, because so many people in our society are struggling with digestive problems and issues with constipation, which will obviously make detoxification extremely difficult. So how do we support the colon? I routinely use soluble fiber with my patient base. Soluble fiber is basically a kind of fiber that absorbs water and toxins that are diluted in water, but there are different sources. Marshmallow, slippery elm, chia seeds, psyllium husks, or flax seeds are all great sources of soluble fiber. And it's a very, very gentle treatment approach that can be used in pregnant women, children, and the elderly without any problem. Only sometimes do we have people sensitive to psyllium husks and who get bloated from it, but I would say that is a minority of people. Insoluble fiber is the roughage or the cellulose that is found in leafy vegetables, particularly raw leafy vegetables and fruit. And again, this is useful because it is slightly abrasive to the intestinal mucosal membrane, and that can be very useful, but it may be a little bit too aggressive in a person who already is struggling with things like loose stools, bloating, or constipation, so they have to be used more carefully. We also have certain botanicals that have strongly stimulating laxative properties like senna or cascara, which can be great when we're trying to really get things to move, but they can become addictive to the colon and they are a little bit irritating. So we don't use them as much in our more sensitive clients. I like to use magnesium or vitamin C in higher dosages to create a laxative effect. It seems to be somewhere between the soluble fiber and the stimulating laxative in terms of intensity of the intervention. We can also use activated charcoal or certain types of clay. They are very well known to be charged minerals and they have a high adsorption capacity, meaning they can bind to many different types of bacterial toxins and other types of toxins in the intestines like mercury derivatives, so that our body can eliminate them more adequately. More mechanically, it's important to remember about traditional enemas, which can be done with either salt water. They can also be done with coffee more traditionally, which has certain stimulating and astringent properties to the intestinal mucosa. The nice thing with enemas is that they can be done at home, and the equipment can be easily found over the counter in any pharmacy. More specialized is the use of colonics, where the person needs to visit a therapist. And basically, a hose is inserted in the anus, and an osmotic solution of salt water is inserted into the colon, travels all the way to the ileocecal valve, and then is then removed through a second hose out of the anus again. It's gentle. It's probably a more complete cleaning than through enemas, but the person does need to travel and see a practitioner, which some patients are reluctant to do. The enemas only clean up the last part of the colon, which is the sigmoid colon. The enema solution doesn't travel up until the ileocecal valve. My favorite is using certain yoga techniques who you can read up about on the internet. The one that I use most is called Shankrakshalana, or the conch pose, which is basically drinking salt water. So it's about a teaspoon of just normal salt, sea salt, put in a liter of lukewarm water. The person drinks 1 glass and then has to do about 5 yoga poses in succession. They're very easy yoga poses. Anyone can do it. And then keep on alternating the saltwater drinking with the yoga poses until about 6 glasses of water have been ingested. At this point, there is a reflex which will make the person want to pass a bowel movement. And then what you do is you keep on alternating 1 glass of water with the yoga poses, and the water will then keep on coming out through bowel movements until, and the person needs to continue until what comes out in the bowels is basically transparent water. So it's very useful because it doesn't just clean out the large intestine, but it is also a cleaning for the whole length of the small intestine. It's generally very safe. The only contraindication is severely constipated patients or people that have quite severe IBS or irritable bowel syndrome. You can read up more about it on the internet, and you can use it with your more vital patients who are not anxiety prone, because some patients are quite high strung and would just stress doing that at home. For those, it's better to send them for a colonic. So you need to assess your patient. So how does the detoxification process occur in practice? Basically, after doing the first intake, it's important to identify which emunctory needs support. So for example, if it's a menstrual problem, most likely it's the liver, gallbladder, colon that needs a little bit more support. If it's, for example, eczema, that's more of a crystal type pathology. We talked about crystal and glue type pathologies in previous videos. But basically, if it's eczema, we consider it a crystal type pathology, or gout would be a crystal type pathology, uric acid accumulation in the blood, crystal type pathology. So in that case, you may need to support the kidneys a little bit more. If it's a glue type accumulation, like an abscess, for example, on the skin, then I would again support the liver, gallbladder, colon a little bit more. Or if it's a lot of mucus production, recurrent ear infections, again, it's a glue type accumulation, and you might want to support the lungs and the liver. So you would then initiate drainage by first supporting the adequate emunctories using homeopathy, botanicals, or lifestyle changes. So remember your sauna, your enemas, using perspiration and exercise, movement to stimulate lymph flow, so for example through a massage, alternating hot and cold showers to stimulate circulation. So all of those would be possibilities on how to start draining the emunctories. And when you see that the emunctories are all right, meaning the person's bowel movements are a little bit better, maybe they have less mucus accumulation in their respiratory system, or their energy levels are a little bit better, you may want to move into supporting more in-depth detoxification mechanisms by adding a cleansing diet that is more or less intense depending on the vitality and general state of the person. This is supposed to be a diet that is limited in time, and so once the person is doing better, you would gradually ease them into a more normal diet, although you'd hope that they would keep certain healthier aspects of their diet looking forward to prevent further illness. So how do you choose the diet for an in-depth detoxification plan? You basically assess your patient for their vital force, their age, how much medication have they been on, how severe is their pathology, how long have they had symptoms, how stressed out are they, and then you implement either a very gentle detox plan or a more aggressive one. So I've put them here in order of gentle to more aggressive. The most gentle one is the most gentle would be 2 weeks we remove alcohol, sugar, caffeine, and other stimulants. That's really the basic. I generally don't just do that. I would at least do a hypoallergenic basic diet, which I will run over in a second for about 10 days. If I feel like they need something a little bit stronger, I may even do the hypoallergenic diet and remove grains entirely for 3 weeks or more. If the person is not stressed out, they're a little bit stronger, you feel like they have quite a bit of vital force, you could do fruit and veggie diet only for a couple, I would say maybe 7 to 8 days. And if you feel like they're motivated, they're not too stressed out, they have a lot of vital force, you can do a few days of a vegetable broth diet, or even a fruit fast, which is more aggressive due to its higher cellulose content, so it's a little bit more abrasive. The body has to work a little bit harder at cleansing itself with a fruit fast. Or if you really want to do something a little bit more intense, you could do a water-only fast. I would suggest starting with only 2 days. If the person has done it before, is well practiced, they're not too stressed, you really want them to be off work. If you do anything longer than 2 days, you could move to 5 days or even 10 days, although I have only done this with one patient and it was closely supervised. So there are really different types of interventions to be able for you to customize according to how your patient is doing. My basic hypoallergenic diet looks like this. You basically avoid gluten, dairy, eggs, sugar, stimulants, alcohol. Okay, you avoid for at least 2 weeks. That is the basic hypoallergenic diet, where you obviously also favor certified organic animal proteins and produce. I use this in people on a lot of medication. I use this on children. I even use this sometimes on pregnant women. This is very, very safe. It's very gentle, but it's very powerful. If you want to make this a little bit more, you can also avoid soy, you can avoid nightshades, you can avoid citrus and corn. You can also take a person's diet, look at what they eat more than 3 or 4 times a week and what they're addicted to, and you remove those and replace them with something else. So in this diet, although it's meant to be slightly hypocaloric compared to their normal intake, you still want to replace those foods with alternatives. So they're still allowed to have gluten-free grains, they're still allowed to have vegan sources of milk, etc. If you're removing grains entirely, you have to tell them that, well, then you have to make sure you're consuming a little bit more fat, vegetables, and protein. The more and more you make the caloric load reduce, the closer and closer you're going towards a fast, the more and more aggressive the diet becomes. So we do have a few contraindications. The more the individual is weak, fragile, or devitalized by, for example, very suppressive drugs, or they're devitalized by burnout and high stress levels, or they're recovering from something that really took energy out of them, the more you need to be gentle in your in-depth detoxification, because remember, the body is only able to drain and detoxify if it has enough energy to put into that detoxification. So the amount of detoxification that will occur is literally proportional to your patient's vital force. As you remove toxic exposure, as you simplify the diet, you're literally freeing some of that vital force to go away from metabolizing those toxins, to go into the detoxification pathways, and help those toxins get eliminated from the body, so the person starts having more energy and feeling better. But so if you put a very devitalized person on an aggressive treatment plan, you won't accomplish much, unfortunately, and you will only create more symptoms as the toxins get recycled in the body. So to illustrate that, I'd like to spend the next 20 minutes or so talking about real-life examples from the clinic. The point of that is for you to really see the variety of patients that we see, so you can assess what it means when a person has more or less vitality, so you can really gauge your treatment plan and therefore practice in a safe manner that will make your patient feel gradually better rather than feel really wretched, and then they won't come back and see you, right? So this is our first case. 28-year-old female. She just recently moved from the US to Singapore, and she had been going through a very stressful period for about a year and a half because she moved and she changed to a different role in her corporation, and the role wasn't what she expected, and she found it extremely stressful with a big learning curve, triggered a lot of her insecurities. It was very difficult. Now things are more quiet, meaning she feels like she's not as overwhelmed, but she still rates her daily stress levels at an 8 out of 10, which is quite high. She is eliminating properly. That's an essential part of the intake, of course, but she is suffering from a number of symptoms. She's extremely tired all the time, especially when waking up in the morning. She's very sleepy in the day and would love to take a nap. She gets a little bit more energy in the evenings, which is a classic sign of adrenal fatigue. She has intense daily headaches, which she never used to get, and she generally feels bloated in her abdominal area and puffy in her arms, legs, and face. So when we analyze this case, we see, great, she's relatively young, she's eliminating well, she's not taking any prescription medication, so that's all really good, and her symptoms are relatively recent. The problem is that she's very devitalized by her own stress. She's really on the brink of burnout. So that is what would make you say, this person can't handle a water fast, she can't handle a vegetable broth fast, and I would say she also can't handle a fruit and vegetable fast. She still has very long work hours, and she pushes herself physically at the gym as well. So unless the person tells you they can be off work, they can go to a beach or take a sabbatical, I generally do not recommend fasting. So for her, we chose a hypoallergenic diet for 3 weeks, which was the basic hypoallergenic diet. So we still included grains, but we removed gluten, dairy, eggs, sugar, stimulants, etc. We talked about stress management and taking it easy for those 3 weeks so that her body can actually use up her energy repairing and cleaning rather than metabolizing stress hormones from overdoing it at the gym or at work. We use liver supportive herbs. We talked about those in a previous presentation, but that would basically be things like milk thistle, dandelion, fumitory, black radish, cruciferous vegetables, and 2 tablespoons of flax seeds daily to make sure she has soluble fiber to absorb the toxins that will be mobilized from the diet and supporting the liver. We can expect this person to feel much, much, much better after the 3 weeks of the diet, after which I would encourage her to identify food intolerances. We'd still work on stress management, basically try to give her ways to stay healthy despite the high amounts of stress until she can figure something out to move to a less stressful lifestyle, which would obviously be the final goal. This is another case, 52-year-old female. She has had episodic symptoms of lupus, so joint pain, modeling on the skin, feeling fatigued. And that started about 10 years ago. Her antibody levels are raised, so her ANA in particular was raised ongoingly for the last 10 years. But actually, most of the time, she's doing fine. Just on and off, she will get episodes with fatigue, joint pain, and a worsening of her skin symptoms. So 3 years ago, she had an episode, and then it sort of calmed down. And now she's in a flare again with intense fatigue and joint pain. She's currently not taking any medication, anti-inflammatory or otherwise, for the lupus, which is great because these would be considered very suppressive drugs, which would make it harder for the body to detoxify and generally an obstacle to our naturopathic treatment. However, she does take hormone replacement therapy for her menopause, meaning she didn't really have symptoms. She went to the gynae, they did a blood test, and they said, oh, you're going into menopause. Why don't you take these topical estrogen and progesterone preparations? And she's also on a cortisone-based nasal spray for her chronic nasal congestion and dry cough, which she's had in the last 2 months, and she's not sure why. Maybe an environmental allergy. So she went and saw the rheumatologist, who said, oh yeah, that could be lupus, your antibody levels are raised, but your inflammatory markers like CRP were not so bad. They were raised, but not terribly raised. So the rheumatologist felt comfortable telling her to wait another few months to see if she really needed the medication. And they did that because the patient didn't really want to start medication. In terms of her elimination, she generally feels a bit bloated, but her bowel movements are smooth and daily, which is great. So when we analyze the case, what do we see here? Patient is generally vital. So this person is well, they're going to work, they're generally functioning, and they're not on any strong suppressive medication, which is good. And although she's had this picture for about 10 years, which is long, the new episode is only recent. So she has mostly been well 80% of the time, and only 20% of the time is she unwell in the last 10 years. So all of that means that she has pretty good vitality. Her body is not totally overwhelmed by the illness and the inflammation. However, lupus is pretty serious. It's an autoimmune condition. This person was also very medical in their mindset. So we chose to do a food intolerance test, which of course showed a lot of intolerances, which is pretty much always the case in autoimmune illness. So she had to go on a really hard diet, which was gluten-free, dairy-free, egg-free, but also corn-free. And she couldn't take a bunch of vegetables, which she loved, that had been in her diet for a long time. And because we are talking about an autoimmune illness that is pretty severe, I told her she needed to do this diet for 3 months, which is actually quite long for people who have never heard of this type of intervention. And we supported her liver and her colon. So again, I used chia seeds, 2 tablespoons a day. We used some liver supportive herbs. I also used heavy duty probiotics for her, meaning a couple hundred billions of different strains per day. And we supported her joints by using glucosamine. And I considered, well, maybe we should also support the kidneys later on, like with a gentle diuretic, because a lot of joint symptoms seem to be more of the crystal type, which calls more for kidney support. And she had a few skin symptoms with the mottled skin, which would again indicate more of a kind of skin, kidney, joint type of triangle. But we haven't moved to that yet. We did start, though, working on regenerating the mucous membrane a little bit, because with those food intolerances, we could suspect a bit of a leaky gut type of picture. And basically, after 3 months of the diet, her fatigue completely cleared. Her joint pain moved down to about 5%. Her rheumatologist said she really didn't need the drugs at this point. And she completely got rid of the abdominal bloating. So that was great. So at that point, I said, why don't you try to reintroduce some foods? Like, she was Colombian and loved her corn-based food, so I allowed her to try corn again. We let her try eggs sparingly, like once a week, and she seemed to be doing fine. And it's funny how people are, because here we are, we improve her autoimmune picture quite considerably, although of course presence of antibodies, that can take years to go down. But suddenly hair loss became a concern for her, which we seem to think with her rheumatologist and her GP that it might actually be from the flare that she had several months ago, that the hair is only responding now to that flare and that it may stabilize by itself. Now we have another case. We see obviously a lot of young children in the practice, and actually children are just perfect candidates for naturopathic medicine. Children, the younger the child, the higher their vitality. Their detox pathways, yes, they already have toxins, but they're not as overloaded and full of toxins as we are. And so, generally speaking, when you remove toxicity in children, they just do very, very well and very quickly. If they have used a lot of prescription drugs, of course, that'll slow down the process, but it's still extremely rewarding. You just need to have a parent who is compliant and disciplined and on board with you, and you can really, really help them. So, this is a mom who brings her 3-year-old boy to the practice. Basically, from being a newborn to about 18 months of life, he had a lot of eczema all over his body, and he was treated with a lot of topical steroid creams like Elomet. And then when he was around 2, things really cleared for him, and he'd been doing great for a year. But suddenly, in the last month, now his eczema has flared all over his body again, particularly bad on his hand, to the point that the hands are cracked and bleeding. And so, mom had to resort to topical steroid creams again. This child's elimination is not great. A lot of our eczema kids generally are not fully constipated, but they will go about every 2 days, or bowel movements are daily but hard. So that's the first place where we need to start working. Unfortunately, this kid's diet was not great. Although he had normal meals, he was pretty picky, so not a lot of vegetables. He had 2 bottles of almond milk per day because he still took a bottle for his naps. At least it wasn't real milk. That can really create eczema. But he was having a lot of cookies, sweets, fruit juice, so a lot of sugar. So that's not great because sugar releases a lot of insulin in the body, and insulin is inflammatory. And that's also not great because all this sugar and starch will feed the wrong bacteria and yeast in the intestines, and they will make their load of toxins, and that will overload the liver, that will overload the lymph, and we will run into skin symptoms. So when we analyze the case, great, it's a young child, so a lot of vitality, but a young child, so it's also fragile. There are certain herbs that we can't use, certain dietary interventions that are too aggressive. We certainly can't do a fast on a child. We can't really restrict their grain intake. They need their carbs. So we have to be gentle, but we also know that we can work really well because of their great vitality. This kid's elimination is not good, so we definitely have to support the liver, gallbladder, colon axis, right? And here, unfortunately, he has been using a highly suppressive drug for a long time. Topical steroids are highly addictive to the skin. They weaken the skin by making it thinner. And unfortunately, because the skin becomes addicted, even as the eczema per se improves, there's a withdrawal effect. And that will definitely slow down the child's progress and his response to our naturopathic treatments. So you need to warn the mom about that it might take a couple of months of improvement, whereas a classical eczema where steroids have not been used typically improves much faster. And also to let them know that they need to really try and restrict the cortisone usage as much as possible, and only use very sparingly and as needed as we start working on the deeper root causes of illness, which is usually toxin accumulation. So definitely basic hypoallergenic diet for this child. So we educate the parent around sugar and fruit juice and all of that, but also no eggs, no gluten, no dairy. And this child was eating quite a bit of soy, so we removed soy as well. I told the mom to switch from her commercial moisturizers to using shea butter, and to dilute 2 drops of sandalwood essential oil in 1 tablespoon of shea butter, because sandalwood has some great properties against eczema. But in children, when you're using essential oils, they need to be super, super diluted, and tell the parents to watch out that the child doesn't put any on their hands, and then from their hands to their mucous membranes or their eyes. And I gave that to the mom as a tool to try and reduce the use of Elomet or other steroid creams as much as possible. And then to support elimination, we did ground flax seeds. That's just my favorite. Although in some children, sometimes I have used liquid magnesium, and I think I did with this child as well, just for the mild and gentle laxative effect, although vitamin C could also be used. So basically, this child, at the 3-week follow-up, it was already a lot better. Although mom still had to use a little bit of steroid, the skin on the hands was still a little bit cracked. And then at the 7-week follow-up, the mom had almost completely discontinued steroids, and his skin was very, very good. He still just had a little bit of dryness on the neck. So I'm hoping that if mom persists, at the next follow-up, things may be good. Although already at the 7-week follow-up, I told her to start reintroducing some food very sparingly and observe the skin's reaction in the child. This is our fourth and more complicated case again, a 30-year-old female. She's been diagnosed a year ago with rheumatoid arthritis, which is an autoimmune condition in which rheumatoid factor is elevated on the blood work. And that started happening after an intense period of stress at work. Unfortunately, she wasn't able to control the symptoms. She had very severe joint pain in the ankles, feet, and fingers that would wake her up at night, that would prevent her from any kind of movement. And after trying different types of cocktails of drugs, her rheumatologist put her on methotrexate, which is a highly suppressive drug which prevents cell replication and is used in chemotherapy. She was on prednisolone, which is a steroid orally, pantoprazole, which is to protect the stomach from the abrasion of the other medications, and she was taking a weekly shot of Actemra with her rheumatologist, which is a biologic and again highly immunosuppressive. She was doing quite well, although she was tired. Her periods were quite irregular and had been for a while. Bowel movements were daily at this point. And what was great is that she had taken a year off to look after her health and really wanted to conceive, which meant she was super motivated to get off, particularly off the methotrexate and the shot, because both of them are contraindicated in pregnancy. Thankfully, her rheumatologist was quite on board. You really want the doctor to be on board with gradually reducing drugs, which is only possible with treating the root cause through our naturopathic treatments. So prior to moving to here, she was in another city where another naturopath had done a urinary test for heavy metals, and she was found to be very high in mercury, and they detoxed her using DMSA, which is a prescription drug. They did that for a few months, repeated the urine test, and her mercury levels had dropped considerably. They had also done a genetic test which showed that her glutathione pathways weren't great, which means her master detoxifying pathways weren't great. And that means she's going to be much more prone to accumulating all sorts of environmental pollutants. Perhaps not a surprise then that she developed an autoimmune illness. She used to experience IBS type symptoms with a lot of bloated, constipation, and diarrhea mostly. And after doing a food intolerance test, which showed a whole bunch of food intolerances, again, very common in autoimmunity, she had been super disciplined in really avoiding these foods, avoiding sugar and alcohol for the last year. So you see that the hypoallergenic diet can be prolonged for long periods of time if the person has a pretty aggressive pathology. So when we analyze this case, we see a patient who is young, therefore vitality is on our side. She's not stressed out, she's off work, that's just great, that allows us to work a lot better. But she's on strongly suppressive medication, which would definitely go against our treatment plan. But her compliance and her desire to conceive, her rheumatologist being on board, all of these are great pluses. So with her, we can stay on the restricted diet indefinitely, meaning until things really resolved, I would say, look, just try and minimize. We did a lot of supplements to support in-depth detoxification. So we used liposomal glutathione to compensate for her genetic mutations in glutathione metabolism. We used digestive enzymes, a lot of things like glutamine, slippery elm, probiotics to just really help the mucous membranes. And we supported the joints with anti-inflammatories, 4 grams a day of omega-3 fish oils, glucosamine, and curcumin. So she was on a lot of supplements, unfortunately. However, it really paid off. So about 6 months into the treatment plan, now she's off methotrexate completely. She's moved to Actemra once a month instead of once a week. And she brought her prednisolone down to 1 milligram. And all of this was very, very minimal flares in her symptoms. So we're very happy. And so this is what we can do if our patient is really motivated, disciplined, and if their doctor is willing to gradually reduce their medications as we work together. So to summarize this presentation, basically drainage, supporting the emunctories, is the first part of most naturopathic treatment protocols. And if you want to move into in-depth detoxification, there is almost always a dietary intervention that you need to customize depending on your patient's overall vitality. How stressed are they? What prescription medications are they taking? How long have they had symptoms? How severe are the symptoms? So the intake is absolutely crucial to get the information you need to tailor your treatment plan to how they're doing. Toxin accumulation in the body leads to symptoms, leads to chronic illness. This was true 3,000 years ago. It's even more relevant today because of the level of environmental pollution that we talked about today. So educate your client about their nutrition, about their exposure, to those pollutants, what they can do even in their own little way to reduce that exposure in the household, right? And you can also talk about certain lifestyle interventions like sauna, perspiration, exercise, massage, that will further support drainage, which is otherwise done mostly with botanicals, supporting the monk trees, as we talked about in the last presentation. We can use more targeted homeopathic remedies made from toxins to support detoxification further. And that is how we move forward with helping the client detoxify and get better. So hopefully this presentation was interesting. You learned a thing or two, and wishing you a great rest of the day.